Good evening, good afternoon, and good morning. This is the 1100. This is the 1014th day of continuous uninterrupted webinar from International Forum for Promoting Homeopathy. As you know, we are conducting the session since last 1013 days. This is something great as far as homeopathy is concerned. Last week, we celebrated our 1000-day celebration at Trivandrum named Sahasra. This is to promote homeopathy to the public. As you all know that International Forum for Promoting Homeopathy comprises of homeopathic lovers, doctors, homeopathic students, as well as teachers from different colleges. Let us begin the session with 1 minute silent prayer. Namaskar, Dr. Nigam sir, Mridul sir, and all. Today we have one of the best day for us because we have two legends. It is 2 to 3 legends are sitting in here to watch the proceedings. That is something great as far as homeopathy is concerned. And we are delighted to have Dr. Amar Nigam. As you know, he is one of the leading physician who has started a private hospital in the Asia's first private hospital at Pune, and which is one of the best as far as homeopathy is concerned. He is using single remedy, and we have a lot of youngsters trained under his hospital, and we have Dr. Mukesh Masels as the guest today. He is presenting some of his best cases here, some of his practical theories, which he developed under the guidance of Dr. Amar Nigam. As you know, he is a young, dynamic, and passionate homeopathy consultant and counselor with a vast experience of advanced, acute, severe pathological and chronic diseases with ability to give results within short duration with homeopathy. He has completed his BHMS and then MD and then PGDCRA from Birmingham and BA Psychology and PGD in Psychology. This is something different from all of this. He has studied the immense, intense desire to study homeopathy as well as other sciences to contribute more to homeopathy, because those who have a well knowledge about the psychology can definitely a winner at homeopathy also. And this is what he is running Masels Classical Homeopathy Clinic and Healing Center at Nashik, Maharashtra. And he is the president of Nikharam Foundation NGO working in the field of social work for the needy people and for the poor and needy patients. He has worked as a tutor for workshop at Aditya Homeopathy Hospital, Pimpri, Pune, Asia's only homeopathy hospital in private sector in the early part of our period. He is a motivational speaker, visited and delivered a speech at different institute of medical college across Maharashtra and Gujarat. He has done different seminars, delivered seminars about homeopathy to students and practitioners at Nashik, Pune, and Gujarat. He has presented many webinars in different parts of India for different webinar sessions in India. He has won different awards. In 2013, he has achieved National Samatha Following Award. In 2017, also he got the same Best Practitioner Award by Lions Club Nashik on the occasion of World Doctors Day. In 2019, Healthcare Excellent Award, Young Homeopath by Divya Bharati and then a Oscar Group in the presence of Rural Development Minister and Honorable Dada Banse, Public Family Welfare and Health Minister, Honorable Eknath Shinde, Maharashtra State Celebrity Vishwas Nagar Patil, Police Commissioner. All these were there at the award-winning ceremony. And first homeopathy physician from Maharashtra hold 4 international and national record and Champions Book of World Record. Golden Book of World Record, and Assam Book of National Record, Indian Book of World Record, 2019 Asian Book of World Record, like that. Work for the society in COVID-19 lockdown period, in Crime Branch Department, Divya Bharati Office, for the newspaper office, MSL company, distributor preventive medicines for more than 5,000 employees at low cost. Preventive homeopathic medicine were given to all staff and reporters. He has done so many works here. So let us directly go to his session here. It is a big biodata from Dr. Mukesh. I am closing all these things. Let us welcome Dr. Mukesh Masel for this session. And it is up to you, Dr. Mukesh Masel, to start the proceedings here.
Thank you very much, Doctor. And big thank to IFPH team for inviting me for this webinar. Dr. Danesh and Dr. Srishel for giving me opportunity to work and to present my clinical cases in front of delegates, homeopathy learner, and legends of homeopathy. So I will start my session without wasting our time. Is it visible, Doctor?
This is
okay. So I will start my session with Guru Vandana. That is Dr. Samuel Hahnemann and Guru of all of us, founder of homeopathy, and Dr. Amartya Nikam sir, my Guru. So I will start my session with his with memorizing these two legends, and I'm very grateful that my Guru is on this webinar, is attending, and he is listening my cases. This is my I'm very lucky that my Guru is in front of me, and I'm presenting my cases in front of my Guru. So we will start our session. So today I have planning to discuss all these cases with you. That is intracerebral hemorrhage, ganglionic cyst, xeroderma pigmentosa, furuncle, Gerson-Gopalan syndrome, PCOS with secondary infertility, tracheoesophageal fistula, angioneurotic edema, red eye, epileptiform convulsions, ITP, dry gangrene, secondary infertility, molluscum contagiosum, pneumonia, and renal stone 18 to 24 mm. So if time permits, we will go one by one. First, I will be sharing with you a very interesting and gross pathological case, which I learned, which I was there at Aditya Homeopathy Hospital for 1 year, and I learned how to deal acute and severe emergencies from Dr. Nikam sir. So this is a case of intracerebral hemorrhage with accelerated hypertension after craniotomy, aspirational pneumonia, immune thrombocytopenia since 13 years. This patient was admitted in ICU. One day I had a call from a senior practitioner from Mumbai. She told me that I have a case who is my relative, but I can't take responsibility as he was my relative. So, sir, can you please help me out in this case? So I told her, so share his present video and share acute condition. So I note, she shared me all the video, first video. I will show you. The case is like this. As a patient was in comatose condition on ventilator, that is on BiPAP, and intensivist planning for tracheostomy within a few hours because of this critical condition, as he was operated 2 times for craniotomy, and after that he landed into comatose condition. So this is very challenging case for a homeopath to deal with. So these are all MRI reports and discharge summary. See, this is a discharge summary of patient intracerebral bleed with accelerated hypertension. You can see here with aspiration pneumonia with idiopathic thrombocytopenic purpura and intensive critical care management with all these antibiotics and osmotic diuretics are there. This case is solved integrated approach, as I was connected with that doctor, senior doctor, and the doctor is connected with intensivist. So it's an integrated approach to this case, which allopathic doctors also helped us very much, and they give us chance to deal with such situation in ICU. This is MRI report. Ill-defined hyperdense acute hemorrhage in right occipitotemporal lobes cortex and subcortical white matter extending into posterior parietal lobe, surrounded by multiple small identified foci of acute hemorrhage. So basically, there is a right occipitotemporal lobes cortex. There is hyperintense acute hemorrhage is there after craniotomy. See, you can see in this slide. And there is a kind of a cerebral edema is there. This is afterwards scan after 3 to 4 days. So we can see, I received this video and I was having only 20 to 30 minutes to think on this case. I'll be running again this video. See, patient is on ventilator in comatose condition and he is on BiPAP. Soon intensivists are planning to shift him on ventilator. So after giving medicine, I prescribe medicine. I asked that senior practitioner to go with this medicine and see the result within 8 hours. See, this is the result. See, he is responding. Patient is responding. He recovered from comatose condition and his BiPAP was gone. See, how is the action of homeopathic medicine? If your medicine is similimum, it acts unconditionally. See first video and this is second. This is follow-up after 15 days. And this is follow-up after 1 month. See how he is walking. Nobody will say that he was undergone such a critical condition after seeing this video. So this is the what people say is magic of homeopathy, but homeopathy is a science. And after 3 months, he came to my clinic and visited my clinic. And he's explaining, he's talking in Hindi, he's explaining about his illness. He was not knowing that he was admitted in hospital. So after
OD is not working.
So after this, see, observe at 14/3 to 2022, his platelet count was 14,000. At 15/3, 61,000, 17/3, 85,000, and on 18/3, it was 1,18,000. That's almost close to normal. And afterwards, there is no drop in platelet count as he was suffering from immune thrombocytopenia since 13 years. So see the action of homeopathic medicine, how it deeply acts, that Dr. Hahnemann was told us in aphorisms. So how is the case? How I handle this case? I received following information from the senior doctor. I was having only 20 to 30 minutes. So our sound senses should be alert while dealing such cases. 34 years old male is on ventilator. Before intubation, that is a semi-ventilator, we called is a BiPAP machine. He was having severe abdominal pain and was lying on abdomen, feeling better by lying on abdomen, continuously talking that he wants to go home and about his shop. He was continuously talking about his businesses. He told me this happens very slowly, but have direct impact on brain after craniotomy surgery. This information gathered by phone. I had not seen the patient. I had seen only video. The physical general desire for sweet, extreme thirsty, thermally patient is hot. Elements from I got this recent overexertion, mostly mental, as he was in financial business management, and his hobbies to do research in financial knowledge and business development. So very dedicated and firm in his decision. I think you are getting these are all information. So as I was having very short time, as I told you, and I analyze this case on my mobile repertory synthesis. So I prescribed with my mathematical knowledge, my organon knowledge, and repertory knowledge. I prescribed medicine in 30 potency. I practice in 30 potency as Dr. Nikam sir uh, taught us. So I proceed further and took rubrics as follows. So is anybody interested to share their totality, if it is possible, sir? Dr. Dhanesh sir? Or we will go ahead? Okay, okay.
We can go ahead.
Okay, okay.
We will have a
So
discussion.
my totality is right-sided medicine, hot patient, extremely thirsty, dryness of mucous membrane, business talks of or industrious. Before going to comatose condition, he was talking about his business. This information gathered from relatives. So I took rubric delirium, talks, business about, and wants to go home. He was having pain in abdomen, which is relieved by lying on painful side or on by better by pressure. This is the characteristic of the medicine. He was very determined as he was firm and very decisive. Desire for sweet, elements from overexertion, complaints develop slowly but forcibly. See this, the doctor was told me, she told me this happens very slowly but having direct impact on brain after craniotomy surgery. So I took this according to my analysis. I took this that complaints develop slowly but forcibly. This is also characteristic to prescribe. It's pneumonia, aspirational pneumonia was there, and intracerebral hemorrhage. So I gathered all these things. And thermal is very much important. Dr. Nikam sir had vast experience, and after using his experience, he coined, he written a book on thermals, manifestation of thermals. So you should go with this book. Why I give more importance to thermal, as it relate to our thermoregulatory mechanism of our body, and it is controlled by our thalamus, hypothalamus, and it gives us clue to medicine. We can easily find out this simillimum. And the most important, thermals are hidden in drug modalities. So we should rely on modalities. Every drug expresses thermal sensations and thermal modalities according to atmospheric and weather change. So these thermal modalities are related to patient's comfort and discomfort. So we can't avoid these thermals while prescribing. If your remedy is lycopodium and patient is chilly, then don't prescribe lycopodium that chilly patient. It won't work. It only palliates the situation. So discomfort feeling, and also depend on their individual cellular metabolism. So this is the importance of thermal. So this is my repertorization. I repertorize on mobile because of lack of time. So mind delirium, mind talking business about uh, stomach thirst for large quantity, abdomen pain, lying on abdomen, ambulation, generals, right-sided, generals, food drinks, sweet desire, and warm aggravation. I give bryonia. So how I give bryonia? So with the repetition of dose after every 10 minutes, as in acute, Dr. Hahnemann says, we need to repeat dose frequently in acute condition till response of the patient. If you are sure that your medicine is perfect, then go ahead with this repetition. This is my experience. And Dr. Nikam sir also told us in acute, we have to repeat frequently. After 8 hours, when I received positive response from the patient, I asked that senior most doctor to repeat medicine after 2 hours for the next 1 day. And afterwards, there is no repetition. This is radar opus, this repertorization chart. See this bryonia. So why bryonia? Why I prescribed bryonia? Because bryonia is having action on meninges. In meningitis, more frequently, we can think of bryonia. Bryonia is having action on blood, is having action on, it's a vicarious bleeding. It is indicated in vicarious bleeding. So it's it in changes affected, it's when bryonia is indicated in blood, in changes affected in quantity, quality, and its circulation. So it causes inflammation and exudation. That's why I prescribe bryonia. And the most important thing which I entered in this case is business talks of having unquenchable thirst. And the third thing is better by pressure. This is a characteristic of bryonia. So dryness of mucous membrane, hence the discharges are also scanty. It covers pneumonia and vicarious bleeding. So see, these are the types of brain hemorrhages. If you think of the subdural hematoma and epidural hematoma, we can think of Crotalus horridus, Lacasis medicine. In subarachnoid hemorrhages, we can think of remedy like belladonna. And intracerebral hemorrhages and meningitis, we can think of this bryonia. This is my observation and my knowledge, according to me. So my references for this is Kent's Repertory, Clark's Mater Medica, volume 1st, 2nd, 3rd, Allen's Keynote, old version, Phatak Mater Medica, complete repertory, synthetic repertory, Organo of Medicine, Comparative Mater Medica by Dr. E. Farrington, the new research in manifestation of miasm by Dr. Nikam sir, and research in thermal Mater Medica, Dr. Nikam sir. So you can take a screenshot of this or photo. This is very important books which Dr. Nikam sir has taught us. So we are having time, right?
Yes.
So we will move ahead with our second case, which is immune thrombocytopenia, ITP. So thrombocytopenia, this is very common in today's life. So this is very interesting, challenging, and risky case for me because of 11-month baby. This patient visited me at 9:30 p.m. and he is from 180 kilometers from Nasik. And at 9:30 p.m., I have to deal with such an emergency case. But I was having confidence as I worked with Dr. Nikam sir in hospital to handle such an emergency cases. So I took this case and go ahead. So ITP, you all knowing what is thrombocytopenia. It's one of the most common causes of low platelets. It's a condition called immune thrombocytopenia. You may hear it called by its old name, that is idiopathic thrombocytopenic purpura. So treatment in allopathy, it's only corticosteroids, intravenous immunoglobulins, and blood transfusion. That is a platelet transfusion. So what happens? What is the pathology of it? thrombocytopenia, our body defense mechanism, that is immune system, failed to work against disease. So antibody is supposed to attack infection, attack infection and mistakenly attacks our platelets. That is a self-destruction mode. So this is very harmful for our body and very risky to deal with such cases as an homeopath. So I was having only 4 to 5 symptoms. That is a high grade of fever, that is 103.4 degree Fahrenheit since 2 days, typical petechial rash since 2 days, restlessness since 2 days, weeping since yesterday. So these are a set of symptoms and I have to prescribe on this. So your observation matters a lot in such an acute condition. So I observed a red color petechial rash on her whole body. She was she's a 11-month girl baby. She was crying continuously and become restless immediately when she enters in my clinic. This is my observation. I asked about activity. I observed she's a dull because her mother is not in a condition to tell. Her mother is crying. Asked about her thermal. Patient's mother replied, she can't tolerate heat. It's a hot patient. See, before treatment, see the rash. See, this is typical petechial rash on her hand, arm. And after treatment, within 8 hours, I got this result. I had a phone call at early morning, 8:30 a.m. And I I had a phone call at 1:30 p.m. night. And her mother told me that patient is fine. She's not crying. She's not restless. Her fever has gone down. I asked them to go for a CBC count at next day. So they did, and see the results. See the date 9/10/2019. Platelet count was 44,000 at 9:30 p.m. At morning 8 a.m. it was 84,000, and more next day, that is 11/10/2019, 1,29,000, morning 8 a.m. These are the reports. See, you can see here 44,000, 84,000, and 1,29,000. The dates are displayed here: 9/10/2019, 10/10, and this one 11/10/2019. So these cases boost our energy. These cases think us that homeopathy is having a very fast and quick action, and homeopathy is a evidence-based medicine. So in past history, she was in contact with uncle, suffered from dengue, physical generals, hot and thirstless, mind restlessness, and unable to sit or stand in one position. This is my observative rubric. So we can hear from it. This video she sent me at 1:30 p.m. night. She's talking about how her fever is reduced
Doctor, your
within
audio is
8
not
hours.
connected. Doctor, your audio is not connected.
Yes.
Audio is not connected, so we can't hear.
Okay, just a minute. Now you can hear me?
Yes, we can hear you, but we can't hear the audio from the video.
Okay. So what should I do for it?
Actually, you will have to close that and yes.
It's in this video is in Marathi. I'm
No,
explaining.
no problem. You just explain.
Okay.
That's enough.
She's talking about how fast homeopathic medicine acts, which she was not having belief on homeopathy. And after these results, see her smile. She's saying that within 8 hours, she got results with homeopathy. So my totality for this, why I prescribed and what is my approach during this case is mind restless, typhus fever with Hustless, typhus fever, petechi, skin eruption, petechi, fever during, miasm syphilitic, and thermally patient is hot. So I give her lacasis 30 with frequent dose. This is my mobile repetition I used in acute cases frequently. So I asked to repeat. We have Dr. Nikam sir also giving one emergency dose. I'm also gave one emergency dose to them with for 20 numbers globules and asked her to repeat 1 hour if she did not feel better. But after 8 hours, actually they repeated only for 5 times, and that's it. And we have results with homeopathy. So what is this condition? This condition is between typhus fever and dengue fever. If the patient did not receive medicine on that night, it might be possibility she may have landed into more difficult situation, like her platelet might be decreased below 20,000, more bleeding from orifices and rashes. So medicine is lacasis. What is the action of lacasis in this case? It decomposes the blood, affects the heart and circulation. Nerves becomes very sensitive. That's why patient becomes restless, especially cutaneous and vasomotor, and excessive sensitiveness of the surface with intolerance of touch or constriction. So this is the action of lacasis. The reference is Clark book. So after seeing these patients, after 25 cases of ITP, I had arranged one press conference on homeopathy. Almost 9 news reporter was there, two news reporter from Hindi and two from TV channel DD Sahyadri 2, and we had conducted this press conference for public awareness. So now we will see how homeopathy is evidence based, because see, every homeopath, this is my appeal to every homeopath, every case you should document, every reports you should have a copy of reports with you, whatever be at the first consultation, in first consultation only. So we'll see the next cases.
Doctor, I think we have the time for discussion.
Okay.
Or how much time you require for this next case?
Just 2 to 3 minutes. I will go.
Okay. You may continue.
Okay. So here I am sharing few clinical cases with you with medicines only. Afterwards, we can discuss. You can personally chat with me. My mobile number is at the end of this slide. So before treatment, results within 7 hours. How fast homeopathy works in angioneurotic edema? I prescribed lycopodium 30, repetition hourly. Next, ganglionic cyst. C. Before treatment and after treatment. Within 7 days, ganglionic cyst had gone with Silicia 35 doses. Xeroderma pigmentosa. This is autosomal recessive disease. This is very rare disease. Almost 3 to 4% cases are there. So before and after, see this. So I prescribed alumina 30, repetition after 10 days. Within 10 days, I got result. This is furuncle or boil. I prescribed sulfur 30 and I got this result within a 12 hours. See, you can see this. See this. And afterwards this. So homeopathy is a fast, gentle, and quick. This is Gerson Gopalan syndrome with plantar psoriasis, erythromycosis, and hyperkeratosis. So this is before treatment, during, within the first month and within second month. I prescribe causticum 30, repetition 3 to 4 times in a 3-month duration. See, this is the result of homeopathy. This is PCOS with secondary infertility, arsenic album 30, repetition 5 to 6 dose in 15 days. The repetition should be according to our knowledge, our experience, and our judgment. Result within 15 days. she got pregnant. This is tracheoesophageal fistula. He was having ASD 7.4 mm, and after treatment, it's 6.3. See, this is in my clinic. He was having gasping condition. In tracheoesophageal fistula, patient can't breathe. He needs oxygen. It's a surgical case, actually. He was operated 2 times, but it was unsuccessful. And see, after results, see how patient is enjoying. See, observe. And these results, I got these results within 72 hours. After prescription of antim-tart 30, repetition 2 hourly. See, this is the patient. This is again a case of angioneurotic edema, Kali-Carb 30 in frequent repetition of 3 doses. This is before treatment. You can observe, and after treatment within 8 to 9 hours. So homeopathy is really very fast. This is a case of red eye. This is very astonishing for me. Results within 3 minutes in my clinic when I prescribed. This epileptiform convulsion case. See, you can see epilepsy. In second video also, I prescribed her Sina 30 repetition, only 2 doses. In single dose, now she's explaining how she is getting results. You observe the patient, observe the child is stable. And with Nikam sir's guidance and his blessings, I entered into animals also. I prescribed almost 40 animals for almost 20 buffaloes and 20 cows. And I took them as a what we got, I had given free medicines for them. So thank you for today's session. I will conclude in only 1 minute. This is my Twitter, LinkedIn, Instagram, Facebook, and YouTube link. This is my mobile number. You can go through it. So how I practice, this is my view. I give importance to body language of patient. I give importance to modalities, aggravation and amelioration factor, which guides us for proper selection of medicine. I give importance to complete symptom, grand generalization. This is very important. If you generalized any symptom, it will become your PQRS, physical generals, thermals, and finally, I balanced physical, thermal, mental, and pathology. If you consider pathology with these 3, then your results are awesome. So, scope of homeopathy, what I think is avoid a long stay in hospital, can treat pathological cases at OPD level, which Dr. Nikam sir had did it marvelously with single dose with minimum conditions. So this is my today's what we call as Sandesh. To success in your mission, you must have a single-minded devotion to your goal. So thank you very much for listening me and giving me opportunity to share my knowledge, to share my clinical cases with all dignities and all respected homeopaths. Thank you very much.
Excellent presentation, Dr. Mukesh Masaji. It's something that really everyone must look into, because he has produced a wonderful session with the
Thank you, sir.
with the pure homeopathy prescription, single remedy. And this is the importance and relevance of studying under great homeopaths like Dr. Amar Nigam sir. All we are all proud of you, Dr. Mukesh, as well as
Thank you, sir.
being a partner of this Dr. Amar Nigam sir schools of thoughts, and he is a person who can deliver something great. I think sir is here. If
Yes,
sir
yes.
is
Please
sir
invite,
is
sir.
here, sir, we all welcome you to this session, and we are delighted to have such a wonderful your presence. And please come forward and make your comments on this forum, as well as Dr. Mukesh presentation, sir. We were Amar Nigam, sir. I think
Yes, I think we should call him. Dr. Sai.
No, no,
Yes.
you can continue now. Yes, other.
yes, sir is there or not?
No, he's not there.
So we can directly go to Dr. Sridhar sir until sir arrives. And
Yes, yes.
welcome Sridhar sir. He's another legend from Kerala, who was a deputy director of CCRH, and he has delivered a lot of presentation in this forum, one of the leading presenter in this forum also. We welcome to this session, sir.
Welcome, sir.
You are from which place? In Maharashtra.
Maharashtra, Nashik.
Okay, I shall meet you. Okay.
Yes, definitely, sir.
I heard that before that the lecture of our Nigam sir, before that the COVID. But after I thought that we cannot travel. Now within 3 months I will meet Nigam sir's hospital, and I will meet you also. That is why
Definitely. Well, you are always welcome, sir.
your presentation were excellent. Today's
Thank you, sir.
even Hindi also. Nigam sir's student was there, so we are very happy. And we are, you please call your friends also, other friends also. And
Yes.
Only-
Sir, we are having a mission homeopathy team. We will soon introduce them also.
in Hindi also, and
Yes.
in Malayalam you may not be able to understand, and but English also. You please come. Excellent. I am giving a quick salute to your boss, that the Nigam sir, and
Thank you, sir. Thank you.
Thank you very much. It was excellent. Keep it up. Okay, thank you. Because others, they like to share their thoughts and their congratulations to you. So I stop here. Thank you very much. I shall definitely meet you. Okay. Because I am in Bombay. It is only 3 or 4 hours.
Yes, sir. Yes.
Okay.
Thank you, Sridhar sir. Dr. Mukesh, we have presented 2 cases in detail, so we can present all the other cases in the coming edition of your presentation.
Yes, definitely. Definitely.
So that everybody can understand how beautifully you are taking the case and how beautifully you are choosing the rubric, and then how to come up with the medicine also. So that is one
Yes.
way. Hope we can have the same in the next presentation. Now it is up to Dr. Manoj, who is the chief moderator of the English session.
Yes, nice presentation and absolutely professional. I think we can fix the next day of presentation. 24th, 22nd, 23rd are vacant. Are you ready to present on that day? Then definitely we can fix it now, Dr. Tanesh.
Yes, definitely. That we will come.
Is it convenient you for 21st of this month or 22nd?
Sir, that we can decide later, sir, because
No, it will go better, Dr. Mukesh.
Yes, sir.
If you are ready, then we can fix that tomorrow, so that those who are participating can have an idea.
No, sir.
Definitely.
Yes, definitely.
Yes. So I think 21st you can fix it now professionally, isn't it?
Yes. Yes, sir.
Dr. Tanesh, please note that. Okay. Anyway, very wonderful presentation. What is more interesting is that you just convened a press meet. That's the most important thing. Most important, most interesting. So that everybody should follow it. A lot of press persons are there. They did publish it. Definitely, this will sending new messages to the common man, as well as to appreciate that they will appreciate homeopathy more. What is
Yes.
more important is that the participation of common man, not the homeopathy fraternity. That is more, unfortunately, our other associations are also trying in that way. That is the specialty of this IFPH. International
Yes.
Forum for Promoting, it is promoting homeopathy. We have persons like Hamadatan sir. He's not a medical doctor, he's not a doctor, but he's a regular participant. He's interested in. So a lot of engineers, lot of specialists are there from different countries, including Turkey. We can have one person here. So that is the most important thing. Anyway, congratulations. You are a real treasure to homeopathy in this future also. Thank you.
Yes, sir.
Yes, now it is the time for Dr. Sri Ahmed Hassan to talk.
Good evening, sir. Dr. Mukesh, sir. Kindly
sir.
give your thank you very much. Stay blessed, sir. Very nice presentation.
Thank you,
I
sir.
am biochemist and in blood bank. I have two cases. One is my wife, so I like to chat on your personal. She
Yes,
was
definitely.
spontaneous CSF rhinorrhea.
Okay.
But by the grace of God, she become all right since 6 years, no problem. Number one, and number two, I have also one case of yesterday, one patient thrombocytopenia, and I
Okay.
suggested her for homeopathy, not for transfusion, because I work in blood bank. I told no use. So kindly
Yes.
share your number. Thank you very much. May Almighty bless you, and also thanks to the IFPH for their nice efforts.
Thank you, sir. Yes.
If some other person want to talk, it is up to you to raise your hand so that we can allow you to talk. And now I invite Dr. Bob Lim from Malaysia. Dr. Bob Lim, are you there? Yes.
Video.
Hello, sorry. I heard my name was called. Okay, I
Yes.
just came back from the from outside, so I was following halfway. I think that was a very good presentation. About this the blood disorder, everything, and anyway, I learned a bit. Though I'm surprised that you can use bryonia also for certain. Have you tried arsenicum before for this blood disorder?
Arsenica album.
Yeah.
Sir, actually, I'm prescribing totality and PQRS symptoms. So if it is indicated, then definitely we can prescribe arsenic.
So you take the totality of the symptoms. Do you include the physical general and the pathological
It is
condition?
definitely important. If we balance this mental, physical, thermal modalities, thermal conditions, and the pathology, then results within a few seconds, within few minutes, few hours, and few days.
Yeah, that's why I was thinking that your repertory was good because you based on this what they call that the hot patient and the cold patient, right?
Yes.
Like you say, if Lyco is chilly, you cannot prescribe Lyco, even though it's a right-sided remedy.
Yes.
Okay,
Because it
thank you very
won't
much.
work, sir.
Yes, thank you very much. I think I learned something today.
Thank you, sir.
Thank you, Dr. Bob Lim. And now it is up to Dr. Paul Joseph of Canada. He's practicing in Canada. He's a wonderful presenter in this forum. And let me invite once again, Dr. Paul Joseph, it's up to you to say something on that.
Hariharan is also raised hand.
Yes, now it is up to Dr. Hariharan sir too. So he is also one of the leading homeopathic doctor from Kerala. He has retired as chief medical officer from government service, and so let us invite Dr. Hariharan sir to say a few words on this session. Sir, come on.
Hello, doctor.
Hello, sir.
Hello, can you hear me?
Yes, sir. We can hear you.
Okay. Doctor, your classical prescription is very nice. I like to congratulate you.
Thank you, sir.
I want to know more about the prescription regarding considering the thermal reaction.
Definitely, sir.
See, which is that book you noted in chat box, that one which is written by Dr. Nikam.
Yes, I will note down in chat box.
Okay, thank you very much. Thank you very much.
Thank you, sir.
If anybody want to talk to Dr. Mukesh, please raise your hand so that it is up to, it's a good time to chat with him. Yes, yes.
Thermal.
Is Masrina from, yes, it is up to Dr. Masrina.
Yes, okay. Thank you, Dr. Dinesh. Thank you for the excellent session, Dr. Mukesh. My question is very simple. I'm referring to your slide on ganglion cyst, where you said you prescribed Silicea 30, 5 doses per day, and you have seen the results within 7 days. I want to know whether those prescription 5 doses per day was continued for over 1 week, or is it for only a few days? I hope you
No,
can.
only for a few days. For 5 days only. Actually, I continuously with contact with patient and ask them if he has to consume dose or not. After seeing the result, there is no need of any dose further. I got
I
result
see.
within 5 doses in 7 days. This is my experience.
Okay. Thank you. Thank you, doctor, for clarifying. Thank you so much.
Thank you, ma'am.
Excellent. Excellent.
Thank you.
And now it is up to Dr. Sri. I'm going to send once again, sir. Yes, yes.
Good evening, sir. Regarding this thrombocytopenia, sir, if you give blood transfusion, it will not respond. It will go worst because
Yes.
I did so many cases of thrombocytopenia in hospital, in ICU ward, and also, so it is going generally worst. So even if you have no medicine and if there is no bleeding, better don't transfuse the anything to the patient. Yani,
Yes,
it
yes,
will harm
definitely.
more. Yeah. So this is my
It will
observation.
destroy platelets after giving.
Yes. So if there is no treatment, suppose in the interior area, better avoid the transfusion of platelet. If there is bleeding, then you have to think. If no bleeding, then even low count, I observe even 30,000 is no bleeding and patient is safe. Yani, the reference range is 1.5
1.5
lakh
to 4.5.
to 4.5, but it is depends person to person,
It is
individual.
depend on constitution to constitution. Yes.
Yes. Some people is having 1,80,000, but no problem. So no need to intervention until there is a symptom of bleeding. Thank you very much, sir.
Now I invite Dr. Srishal for your comments on this session.
Yes, sir. Mukesh, Dr. Mukesh, wonderful session and
Thank you.
very nicely explained the cases. And I'm feeling very proud of you, being you have spent wonderful times in Aditya Homeopathic Hospital together.
Yes.
And getting a nice screen today.
Yes, that is the tribute to you, Dr. Mukesh. And now it is up to our Vice President, Dr. Shaji Kuriyat, who is the instrumental in bringing out such a wonderful forum for us. So let me invite Dr. Shaji Kuriyat, the Vice President of International Forum for Promoting Homeopathy.
I just thank you, Dr. Mukesh, for attending our forum. Actually, I just joined, so I was unable to listen to the whole session. So I am not in a position to make any comment or ask any questions. But I, from the bottom of my heart, congratulate and thank you for joining our forum and expecting more sessions from you. Thank you.
Thank you, sir.
Okay. Whether our Nigam sir is available or not?
No, he's outside.
Okay, no problem. We can go ahead with our sessions. Anyway, this shows the power of homeopathy, and it is the duty of each and every homeopathic doctor to produce these things in front of the public as well as media. This is a wonderful thing Dr. Mukesh has done. in this forum, and he has produced his presentations here, and he not only presented here, but just put it into the public media so that public will know what is happening with homeopathy in such incurable cases, how beautifully, how quickly, how short, within a short span, you have produced such wonderful cures. And this is really a contribution to your contribution to homeopathy. This is what every homeopath shall do and must come forward to do all these things in public. And I think Dr. Hariharan sir wants to communicate to you once more. So it is up to you, sir. And then Dr. Hariharan sir can say vote of thanks also, because the time is running out and we are about to close the session. So it is up to Hariharan doctors to say vote of thanks after your communication.
Sir, please put your telephone number to the chat box, first of all. Then I like to congratulate you. See, you have done a wonderful work for us. See, you are a boon for homeopathic field. No doubt in that. Thank you very much, Doctor. Come again. Okay.
This is something great, because homeopathy is growing, and we are about to catch as the #1 system in the world. As everybody know that we are just short of some miles to go, but still we will work together. Like this presentation, more and more people will come towards homeopathy. We will have to publish all these things. Very recently on Sahasra, we have done a wonderful job in that, and we made a lot of public meeting for that, and media has given beautiful narrations. Even today in Tamil newspaper, there was a report about our homeopathic power of homeopathy by the group of people under this international forum. Those who want to participate can and want to present can come forward with your presentation, so that we will allow you to present in this forum, and so that we can take homeopathy in the #1 position in the world. With that, I come to let us conclude the session. Tomorrow we will have session from Dr. Mridul Kumar Sahani sir, and his session is impact of social media on health and its homeopathic approach. This is one thing that we will have to look into also, because a lot of problems are arising due to social media. How can we tackle these things with homeopathy? And that it will be discussed by another legend from homeopathy, Dr. Mridul Kumar Sahani. With that, I conclude this session, and thank you, Dr. Mukesh, once again. We will meet again.
Thank you, sir.
As per your convenience in the next presentation. And now I hand over the session to Dr. Manoj for our local language session, Malayalam. Thank you all.